Hi, and welcome to Coping During the COVID Crisis. I'm Janet Gross. One of the things we learned from the Spanish flu pandemic about 100 years ago, there will be waves, most likely anyway. The disease spread declines overall and then picks up again. We've been told it'll come, but when and how hard it'll hit, nobody knows. We're going to talk about preparing for that second wave. And as always, we have Dr. Roy Salgado, professor of counseling at the University of Holy Cross, here to talk about it with us. Hey, Roy. So, okay, we're looking forward to it. Not looking forward to a second wave.
I certainly am not.
Preparing, but this isn't it. I mean, because we've seen big spikes, but this isn't it.
Right. We are still in our first wave, and our first wave is in large part contingent upon our behaviors. And our second wave, if we get a second wave, God willing, we don't. But if we do, it would in large part due to our collective behaviors. The first wave, there's really nothing that we could have done about it. It just came, it took us by surprise. We think back to early March, how the first case was reported in the United States, and then within days, everyone had to move into action. And within 5 days, here in the city of New Orleans, we were in stay-at-home orders. And so we were being reactionary. We were being interventionary in that way. Right now, what we are challenged to do is to be preventative in nature. Instead of intervening after it came, the first wave, we need to prevent perhaps a second wave, or be preventative in nature and be prepared for a second wave for when that does come. And we need to make a distinction between this first wave and a potential second wave. A first wave is one in which there may be ebbs and flows, peaks and valleys, spikes and dips in reported cases. And right now, we're seeing that increase in cases, and that's in large part due to the behaviors and activities of people in a given community. And so if we're seeing spikes right now, it's because perhaps as a community, we're not adhering to the measures that are being recommended. In order for us to see a dip in this first wave, we need to get down to single-digit numbers. We need to get to very low numbers for us to be considered, okay, we're in the clear. And then if we get a second wave, it's because there has been a new introduction into the population of a COVID-19 case. And so if that were to be the case, that could potentially come in the fall or in the winter, and we'd need to put a preparedness plan in place for when that were to take place.
You know, when they were talking about second waves early on, or a second wave early on, they thought it would, the virus would die down in the heat of the summer, but that has not proved to be the case.
Yeah.
And in fact has been proven in Southeast Asian countries, where it's just hot all the time, and it's still flourishing.
Central America right now, they're having their spikes right now.
It's hot.
It's hot. It's hot right now, and they are having their spikes due to mobility and people moving in and about, even though they have stay-at-home orders as well. But people are moving out and about, and the contagion is spreading from person to person because of touching one's face, not wearing a mask that covers your mouth or your nose, and speaking and not staying in that social distancing of 6 feet. And so we need to keep all of these things in place, wash our hands consistently and maintain that physical distance or that social distance of 6 feet, as well as not touching our faces, in order to slow the spread. We're not going to get rid of it 100%. That's up to this point not possible until we perhaps have a vaccine. But until then, we need to put these measures in place consistently and just have it be part of our everyday life until we do have a vaccine. Otherwise, we're going to have these spikes from time to time.
Because these are things we know we can do to help.
We can do this. We can do this. We have done this. We know that we can do this. Here in our area in Southeast Louisiana, we had a spike in March and April, and we flattened the curve. We actually were able to bring the numbers down and slow the spread. We as a community successfully were able to do it. We've gotten a little antsy in the past several weeks and have been moving about and perhaps being laxed in our interactions with people outside of our households. But we need to kind of rein it in and be mindful of that so as to mitigate, slow the spread in this first wave, and perhaps to the best of our ability, not contribute to a second wave.
Because anything we do to lower our guard can make the risk higher.
All you have to do is have one person go and infect a community, and that 1 can become 2, can become 4, 8, 16, 32, so on and so forth. And so it can spread exponentially if we're not mindful. We need to be responsible for ourselves and how we interact with others so that we can not be the one who's the culprit, if you will, in spreading the disease.
That is the thing about social responsibility, huh? There is a personal responsibility you have, not just for yourself, but for the other person.
For the other, we have to. For everyone else, you know, you might be a healthy individual who might only get the sniffles, if you will. But then if you're around other people and those who are members of a vulnerable population who have compromised immune systems, then you're really contributing to someone potentially taking really ill to the disease, having a tough time with it, and maybe it even being fatal for them. And so I can imagine anyone wanting to have that on their conscience.
Right, and even now with all that we're constantly learning about the virus, it's affecting, 20 to 30-year-olds, especially now.
Right.
I mean, so you don't know who you're gonna hurt.
So we all need to play our part in washing our hands continuously, in wearing masks that cover our mouths and our nose when we're out in public, to maintain that physical distance, that social distance from one another, 6 feet, and wash and clean common surfaces. We just need to do this consistently, and we can't reiterate this enough. It is something that we just simply need to ingrain into our brains, that we have to do this for other.
And as we look ahead and maybe see more problems ahead, I know it's been so tough on so many people, just this first wave and the whole newness of it all. But that anxiety and maybe some depression and some of the things that fall in line because of this are going to cause people problems.
Right.
You know that.
Right.
I know the University of Holy Cross is there to help, and that's why one of the reasons we do this show is to help people.
Right.
This is to really reach out on a one-on-one. Tell us about that.
Yes. You know, we're all dealing with a very difficult time right now. Anxiety and depression is really going up. A lot of the literature is showing how anxiety and depression has gone up due to not only COVID itself, but the stay-at-home orders and the lifestyle changes that we have all had to make. It's really impacting our emotional response to things. The University of Holy Cross is there to be able to help the community out if you're struggling with any of these things. And the economic impact that has also been a factor, a significant factor in all of this. And we're there to provide this service free of charge to the community in the state of Louisiana, to anyone who thinks that they could benefit from professional help from one of our counselor interns.
Call this number that's will be on the screen throughout the show.
Yes.
So you can set up an appointment.
Yes.
Okay. All right. Thanks, Roy. Okay. Well, when we come back, we're going to talk about how counseling might help you if you feel overly anxious about a second wave and what that might mean. Stay with us. And welcome back. Well, whether we are approaching a second wave or we're actually in it or we're just waiting for it, the second wave of this pandemic is not a pleasant thought. Joining us now to help us prepare for what may come, Dr. Ryan White, the director of the Thomas E. Chambers Counseling Center at the University of Holy Cross, is joining us to really help us talk through this. What can counseling, Dr. Salgado was just talking about the counseling service offered by the University of Holy Cross. And people sometimes need to talk this through because it is ever changing. It's always the next day. What? What's going to happen? How can you help?
Well, you said it yourself that things are ever changing. And I think in some ways, forewarned is forearmed. When all of this started, the majority of people were not really expecting it and really had no idea what the new normal was going to be. And over the past several months have worked very hard to adapt to changing circumstances. And I think now that there's all this talk about a second wave that's ratcheting up the anxiety in people who thought that they were just starting to get used to this and maybe be looking at the end of it, and now it's stretching out into the future, and it's the return of that early uncertainty. And so one of the things that can help when speaking with a counselor is, now that the clients have the experience of living through and adapting to this first wave, again, forewarned is forearmed, they can look at what the likely circumstances are going to be for the second one and maybe prepare for riding it better.
You know, that's a very good point of preparing to write it better. We did not know what to expect. I don't know that many of us realized that as a result of this first wave back in March, that several weeks into it, that there'd be these stay-at-home orders that would then impact us economically, people losing their jobs. And so knowing that a second wave could have that impact as well, you know, my job could be impacted with a second wave. Even those who perhaps their jobs weren't impacted during this first wave, there's nothing that says that it can't perhaps impact it in the second wave. Preparing for all of these possible scenarios beforehand, you know, to be armed, as Dr. White suggested, to be prepared, because the more prepared you are, the better you are to fare an outcome, or at least handle it more effectively and not be in panic mode.
And I guess in conversations, helping people to plan ahead is something that might help them down the road and help them immediately, you know, mentally, but down the road, actually, in their circumstances, right?
Yes, absolutely. And again, a lot of it also comes to managing anxiety. When this started, many of the clients who were coming in from the community, COVID was primary among their concerns. And then as the weeks passed, you know, they had other things that they wanted to work on. And now that's coming back to the forefront of their minds. And that anxiety can be paralytic if it is not managed. It can make it more difficult for them to look at things rationally and to be able to examine their circumstances and prepare as best they can, if instead they're in a mental or emotional state where they're not able to think and work at their best.
So is there a likelihood that people go, I can't go through this again? That kind of attitude?
Yes.
You know,
it's fatigue.
It is fatigue, and to help mitigate that fatigue, you have to prepare on a number of different domains. You have to prepare mentally, emotionally, physically, financially, spiritually. You have to make sure that all of those things are in place so you can approach it from different angles, because you have to approach this from an emotional and mental health standpoint. You have to approach it from a physical health standpoint. You have to approach it from a spiritual standpoint and a financial standpoint. If you ignore any one of those areas, you might be surprised of how it's going to come at you and hit you in any given area. All of this is something that counselors can help you kind of think about more clearly prior to something coming your way, and to really think clearly and to be able to plan and prevent and think ahead.
Is it helpful, well, helpful is a strange word to use in this, but to have gone through it and survived it? And so can counselors kind of help pull you back to that and say, you got through it, you can do it, kind of that kind of thing?
Perseverance in past adversity is always a resource to draw on, that experience, to be able to say, okay, what is it that worked for you before? What is it that did not maybe work for you as well as it could have? And how does knowing all of that help you go into these future events better prepared?
Yeah, letting them know you've got this. You know, you've done this before. You've got this. And even if you yourself didn't find yourself being impacted in a given way, you've seen other people go through this, and you can make better plans for yourself so that perhaps avoid it, or as it comes, know how to handle it because others have already gone through it in your community. And so there is something to be said for the resiliency that someone can develop as a result of having gone through something before.
Is there less panic, do you think, the second time around, or is that hard to really gauge?
I don't know. I think right now none of us are wanting to even think about the possibility of a second wave, but something that we will be able to handle more effectively because we're talking about it and because we're thinking about it, and perhaps being more proactive in staying one off.
Dr. White, what about watching, keeping up with the news, or overindulging in the news about, you know, all the different changes and the things and the spikes and the laws? And
I think that varies on a case-by-case basis because different people have different thresholds for how much engagement they can have with this information before it begins to ratchet their anxiety up to unmanageable levels. So that's something that you have to figure out on an individual basis. That said, it is still important to be aware. And so with any client, you want to discuss how it is that they can best make themselves aware of continually changing circumstances without, just cyclically continuing to feed the anxiety and the depression, the fatigue and the hopelessness by drowning themselves in news and stories, and most especially in speculation.
I know it helps to talk to a counselor or somebody, or
Right.
even somebody, your neighbor.
Right. And staying informed is important, and at the same time to not get caught up in that speculation and those different ideas of misinformation or disinformation that you're getting from other people, not necessarily only from government and media, but from people in the community. Just to keep a level head, and a counselor can offer that to you. A counselor is neutral and objective and is looking at things from a third-party perspective that can kind of cipher through all of that noise and bring clarity to a situation so that you are informed and stay informed and kind of get rid of all of the noise that is clouding our judgment and our thinking.
It can. Sometimes if you don't listen to the right source, you are hurting yourself, and at least a counselor is unbiased.
Right.
Yeah? Is that kind of what?
Right. And it's that unbiased, neutral mindset that can bring calm to a person who perhaps is afraid or frazzled or anxious under these circumstances.
Dr. White, are you getting people who are concerned, or are you anybody in your clients being concerned about a second wave, or what's going to happen in the fall, or what's going to happen?
It has started to trickle in. Again, for a short period there, many of our new clients who had more or less adapted to these circumstances, that wasn't the primary concern that they had, but we are again starting to hear people coming in and saying that, yes, they are stressed, they are anxious over the possibility of this continuing. They don't always use the terminology second wave, but just the fact that this could still be going on into the fall, into who knows how long. And again, that prevailing theme of uncertainty, worry.
Okay.
Yes, we're starting to see that again.
Well, thank you, Dr. White, for joining us and talking with us. We're going to be back in a moment with more ideas facing the future.
Why should young people care about the spread of coronavirus? Well, we know that people with underlying medical conditions over the age of 60 are at highest risk, but they've got to get it from somebody.
So we're asking everyone to be selfless for others so that we can protect those who are most susceptible.
Not going to bars, not going to restaurants. It all just means physical separation so that you have a space between you and others.
For more information on how you can social distance, please go to coronavirus.gov.
Even as we learn more and more about the coronavirus, we still don't know what turns it will take and where it might take us. We've asked Dr. Dottie Martin, counseling professor at the University of Holy Cross, to join our conversation. Thanks for joining us.
Thanks for having me.
Great. Dr. Roy and I have been talking about how counseling can help people get through this. If there is a second wave, even if this first wave continues indefinitely, it's draining.
Right. Yeah, that's a lot of what we're seeing and hearing from clients is that the unknown and how scary that is, and not knowing how to proceed, and that they're feeling a huge loss of control in their own lives, a loss of control in their community, with their health, and it's scary and frustrating and overwhelming.
Normally, as you plan your life, there are ups and downs, and you might say, I'm going to look for a new job, or I'm going to do this. I'm going to spend money on this thing we've been saving up. All those things are kind of changed now, especially when you look at the future and go, is it going to be back to normal soon, or when, or is it going to be worse?
And with that loss of control, we have lost control over some of the really big things, in terms of how we interact out in the world with one another, to wear a mask, to not wear a mask. We have to wear masks in certain municipalities and parishes. And so we simply have to do these things. And so we have a loss of control with regard to that, and a loss of control with regard to jobs. Some people have just simply lost their jobs. But we do have control over certain things. We can wash our hands. We can maintain a physical distance from other people. And to be able to accentuate those things, we have control over our own health. And while we have lost control over some of these larger things, if we feel that we have control over some of these smaller, more personal, independent things, then those other things we can not feel so overwhelmed by, because we do have control in certain things in our lives, and we need to take ownership of that.
I guess loss of control in any situation, but especially during a situation that is so scary, so unpredictable, has certainly been accelerated. What do you think, Doctor?
Absolutely, absolutely. And counselors can really help clients with normalizing that, helping them to understand that. And then, like Dr. Salgado said, helping them navigate finding those things that they can control and the positives that they do have, and, you know, helping them move in that direction. So really just normalizing the feelings and emotions they're having. And as, you know, as we look at a second wave, that could possibly be, you know, accelerating for them. And just normalizing that, understanding that. I said in the beginning, you know, clients are having normal reactions to an abnormal situation, and that still continues today. So just, you know, sitting with them, listening to them, and normalizing their emotions and their feelings. And then again, like Dr. Salgado said, helping them find the things that they can do, that they can control, to kind of alleviate some of that pressure.
You know, here in the New Orleans area, we are familiar with having things not go our way and be out of control and out of our control. Hurricanes, for example. We get hurricanes and we get threats of hurricanes, you know, all of the time. You know, sometimes we get a big Category 5 that's this sense of impending doom, and then really nothing happens. It kind of like dissipates and goes away. Or we get a tropical storm that comes and just decimates a community. And so those are things over which we have no control. But the things over which we do have control is preparing for it. We can prepare for a tropical storm. We can prepare for a hurricane. A potential second wave is similar in many ways. We can prepare to the best of our ability for something of that nature, with buying the products that we need, having soap and hand sanitizer. I know that they're scarce, but that we can think ahead and really plan for ourselves and our families so that we can stay healthy to the best of our ability. The bigger things, perhaps we have no control over, but to the extent that we can, just like we don't have control over a Category 5, we don't have control over COVID-19 per se, but we can have control over our health and our well-being in terms of not catching the contagion or spreading it ourselves.
And Doctor, does that help? Does that help kind of ease fears to know that you have control over something?
Sure, right, absolutely. I say in counseling all the time, celebrate the small victories till you can get to those bigger ones. And so really helping clients understand that those small things mean a lot as we progress and move forward. Absolutely.
When you counsel people, do you think you're helping more than just that one person because they have, you know, their immediate people? Do you feel that as well?
I do. I'm a systemic counselor, so I absolutely look at the whole system. And when you help one, it trickles over into other units. So absolutely.
Because I'm thinking that if people are asking you questions about, you know, for their concerns, they're also asking you questions that they've heard from others, maybe.
Right. You know, and when you think about it systemically, when you have that individual who has made an individual change, and then they go out and people notice there's something different about you, you're doing something differently, then they start to respond to it, and then the system is impacted by that one individual making the necessary changes for themselves.
And it's a trickle-down mental health thing.
Absolutely.
I like that. You know, I think that, and I'm just going to bring up this one thing that I saw on the news in somewhere in Texas. You know, they're having runs on everything because of, you know, people there are seeing this spike, not a second wave, but a spike.
Right.
And they're thinking, okay, you know what? I know I didn't have enough of this before. If I see it at the store, I'm getting it.
And they're probably learning from other regions. You know, here in the New Orleans area, we experienced our peak in March and April. New York, the Northeast, they peaked at that same time as well. And so there are different regions of the country that perhaps are experiencing a peak for their first time. And so they're seeing what happened in the previous situations and are responding in a very similar fashion. And so we're probably going to see this play itself out over the course of the next several weeks and months in this way.
So we can learn from our past and from others' past, I guess, even in this small, since mid-March coronavirus past. Do you think, Doctor?
Right, exactly. And then for counselors helping clients to recognize that. So, we did get through it, we moved through it. And so going back and finding those things that worked for them, what helped them, and how they can build on that, if we do go into a second wave.
When you talk about making a plan, are you talking about making a plan where you can actually sit down and write down a plan? Something that is physical?
Absolutely. Absolutely. That's something counselors can do with clients, to help them navigate what they need to do. Sometimes we get so busy, lots of times we get so busy just moving through things, it just takes that sitting back and really reorganizing and readjusting to what you have to do.
Okay.
In the first wave, we've had to intervene and jump in and react to the situation. Now with a potential second wave, or even with the peaks that we're experiencing at this time, within still this first wave, we can think back and learn from our previous experience and implement a plan. You can write it out. You say, you know what, in the past we ran out of these things, we needed these supplies, we needed this, and to just write it out and implement it. When we write things out, we tend to implement it more so than if we just think about it.
Yeah, that's me. If I don't write it down, I'll forget it. Yeah.
Yes.
or say, what? I know it's similar. Yeah. All right. Well, Dr. Dottie Martin, thank you so much for joining us and for talking about this with us. We appreciate it. Okay. Okay, Dr. Salgado, you have some tips to round out this?
Yes, and the tips that we have are reiterating tips that we have had in the past. And it's important that we inform ourselves and that we assess our personal situations. We have to stay on top of this. It changes from week to week. We have to have an emergency plan in place. This is something that perhaps we haven't discussed in the past, but we need to have an emergency plan in place. Start to think about these things 3 or 4 months out, so you know how to respond in the event that you lose your job, in the event that schools close again from one day to the next, in the event that there's a revenue stream that isn't coming in. You need to have an emergency plan in place. In the event that
somebody's sick.
If someone gets sick, if someone in your family actually contracts the contagion that perhaps it didn't happen before, implementing all of these things in place.
Where will you put them? Where will they stay? How will we get,
Right. Discuss this with the family beforehand so you'll know how to proceed. Maintain personal hygiene consistently. Again, washing hands repeatedly, practicing social distancing, physical distancing, maintaining that 6 feet of distance, and covering your mouth and nose with a mask whenever you go out into a public area, a grocery store, another place of business.
Right.
And just consistently doing that. And just thinking ahead and being preventative in nature as opposed to interventative as we did back in March.
Right, because now we know that those things work.
They do work.
We know that although for some reason they're still optional in many places, we know they work. And so you're not only just protecting you, you're protecting your family or the next person you come in contact with or whatever.
That's correct. They do work. We've seen it work. We've done it before. We can do it again. Okay,
and we need to keep that. I like it that you keep bringing that up because it's going to be our life for a while.
We have to repeat. Consistency is the key.
Okay. Thank you, Dr. Roy Salgado, and your colleagues at the University of Holy Cross for joining us today. And thank you for watching. We want to help you as we are all coping during the COVID crisis.